I will call each all question in the normal way. I will then, questions and answers are short, because if they're not, it knocks other people lower down the list out. And I apologise in advance if it's not possible for everyone to be called. Please ensure that you unmute your microphone prior to asking your supplementary question. Your microphone will be returned to mute when you have finished speaking. So in accordance with guidance agreed by the Procedure Committee, if your name is not listed, it is not possible to ask a supplementary question nor take part in the proceedings. So having said that, my lords, I call Lord McConnell of Glenscoe to ask the first all question.
My lords, I beg leave to ask the question standing in my name on the order paper.
Minister Baroness Sugg.
My lords, the COVID-19 pandemic is the biggest threat this country and the world has faced in our lifetimes. And here in the UK and across the globe, we're seeing the devastating impact of this virus. The UK is at the forefront of the international response, having so far pledged £744 million in UK aid. And this requires a prioritisation of planned spend for this financial year and beyond, both for our immediate response and to support longer term recovery.
Lord McConnell, supplementary question.
My lords, the 22nd of April has been celebrated since 1970 as Earth Day, a day when we celebrate and recognise participation and advocacy around the world. And it seems therefore appropriate that today we look at the international consequences, particularly in the developing world, of the COVID-19 crisis. The Sustainable Development Goals were designed to create more resilient and sustainable economies and societies around the world. And I'd like to ask the government if they will this year ensure that the commitment to the Sustainable Development Goals nationally and globally is strengthened rather than weakened to ensure that we are better able in the future to respond to and cope with shocks of an economic and health nature as we are currently experiencing both in the developed world and in the developing world.
Minister.
My lords, the UK played an instrumental role in establishing the SDGs, and even before COVID-19 we knew global progress was off track. I'm particularly concerned with Goal 4, quality education, and Goal 5, gender equality. The SDGs do have a key role in framing and shaping recovery, and the decade of action is going to be more crucial than ever. We'll use the international opportunities we have to build our continued SDG leadership, and we will include in that the SDG Summit at UNGA this September and also our G7 presidency next year.
Baroness Hodgson of Abinger, supplementary question.
My lords, women and girls are being disproportionately affected by the impact of COVID-19. Please can my noble friend the Minister assure me that DFID will address the specific vulnerabilities that women and girls are facing in the light of the pandemic, and looking ahead, that women and girls will remain a key focus for DFID.
Minister.
Thank my noble friend for that question, and of course she is right. During times of crisis, women's and girls' rights are often overlooked, and it's now in this time of crisis and when people are at their most vulnerable that women and girls need our support more than ever. We must learn the lessons of past epidemics and explicitly include women and girls' needs as part of our humanitarian response and to stop more lives being needlessly lost. So we're working with our international partners to act now, putting gender at the heart of our response. And the impacts of coronavirus are not gender blind, so nor should our response be.
Baroness Boycott, supplementary question. No. Lord Collins of Highbury, supplementary question.
Yes, I'd like to ask the Minister, a key element of nutrition-sensitive spending is universal health coverage, vital to building resilience to such pandemics. It's likely that the Nutrition for Growth Summit will be delayed. Can the Minister assure the House, if this year's summit is delayed, she will ensure either the government pledges early or will ensure continuation of nutrition finance at current levels for another year to avoid a cliff edge in such financing at the start of 2022?
Minister.
The Noble Lord's right to highlight that global commitments on nutrition financing are indeed ending this year, and I agree with him that this continued investment is needed to prevent and treat malnutrition. particularly as countries face worsening levels of malnutrition in the face of COVID-19. We're looking carefully at the options for the UK commitment now that both the Olympic pledging event and the main Nutrition for Growth Summit has been postponed, and we'll provide an update on our plans when we're able to. My Lords, the World Food Programme yesterday reported that COVID-19 could push 265 million people into acute hunger by the end of this year, so maintaining our commitment to nutrition is more important than ever.
Baroness Sheehan, supplementary question.
My Lords, I have two questions for the Minister. Firstly, borders are an ineffectual barrier against COVID-19. So does the Minister agree that only a victory that fully includes Africa and the rest of the developing world can end this pandemic? And secondly, notwithstanding President Trump's intervention, does our government acknowledge that we need a World Health Organization fully equipped to coordinate an international pooling mechanism for COVID-19 research into diagnostics, treatments and vaccines that will be affordable for all?
Minister?
My Lords, of course, COVID-19 is a global challenge, and it's essential that countries come together to tackle the shared threat. We will continue to fund the World Health Organization. We're a key donor to the WHO, and we've already contributed £75 million to help the organisation lead international efforts to stop the spread of the virus, find a vaccine and end this pandemic.
Lord Mann, supplementary question.
Considering, my Lords, the consequential hunger problems that have been identified, can the Minister guarantee that the UK support for the work of UNFPA and the budgetary support will be guaranteed throughout the next 12 months?
Minister?
My Lords, we are of course a key donor to UNFPA. We recently announced a £200 million humanitarian package, and that includes an additional £10 million support to the UNFPA, and we will continue to support them in the vital work that they do.
Lord Sheikh.
My Lords, we all appreciate that COVID-19 is a hidden enemy that attacks anyone, anywhere in the world. My Lord, some countries overseas are in dire straits. It is important that we continue to provide help to foreign countries. Can I ask my noble friend, the Minister, if it is possible in the present climate to maintain the spend of 0.7% of a gross national income on foreign aid?
Minister?
Absolutely, I can confirm our commitment to 0.7%. We need to both respond multilaterally through the global system, but also bilaterally in country. And we're working quickly to pivot our programming to support the COVID response, reinforcing health and humanitarian and social protections or economic support programmes within country.
Lord Crisp, supplementary question.
My Lords, I very much welcome the investment the government is making in vaccines against COVID-19. And I would ask the noble lady if the government will impose public interest conditions on UK-funded vaccines, treatments and diagnostics so that they can be affordable and accessible not only in the UK but also to low and middle income countries. And will the government also encourage and persuade other governments to do the same?
Minister?
My Lords, we absolutely need an effective COVID-19 vaccine to be developed and trialled and approved for use as quickly as possible. We're doing that in three ways. We're the largest funder to the Coalition for Epidemic Preparedness. Secondly, we've launched a vaccine task force to expedite and coordinate efforts to research then produce the coronavirus. And finally, we're hosting a replenishment for Gavi, the Vaccine Alliance, in June. And that's going to be really key to the operational delivery of a vaccine across the world to those who need it at an affordable price.
Lord Boateng, supplementary question. No. Lord Bruce of Beneshee, supplementary question.
Thank you. Minister, the DFID has given priority to strengthening health systems across Africa. Can we be assured that that will be maintained, if not increased, especially in the light of falling GDP at home? And what does she think about the WHO's advice that there should be no restrictions to travel into Africa, given that the disease is escalating there and that has proved to be a factor in spreading it worldwide?
Well, my lords, I agree. We absolutely need to strengthen the fragile health systems in the world's poorest countries, where the chance of disease spreading rapidly is at the highest, and that's of course going to reduce the risk of future waves of infection globally. I'm not going to comment on the WHO's advice on travel into Africa. What I would say, though, is that it's important that we maintain connectivity, both so we can support our aid delivery in the countries which are sometimes hardest to reach.
Baroness Massey of Darwin, supplementary? No. There are no more supplementaries. My lords, the time has also elapsed for this question. My lords, we now come to the second oral question. Lord Blunkett.
I beg to move the question on the order paper standing in my name.
Minister? Lord Bethell. Lord Bethell?
We recognise that through shielding, though shielding is for individuals for their own protection, it is an immense undertaking. Decisions to advise shielding were taken after very careful consideration. The implications for those concerned are profound.
Now exiting.
We are constantly reviewing all social distancing measures and will continue balancing the need to protect the clinically extremely vulnerable from contracting COVID-19 against the restrictions this places on their lives.
Minister?
My lords, I appreciate greatly the work that Noble Lord the Minister, his team and colleagues are doing. And I know he will join me in appreciating the hundreds of thousands of volunteers and mutual aid programs at local level across the country as well, who are supporting people who are trapped in their homes. I wonder whether the Noble Lord the Minister would discuss with his colleagues what particular measures which would not put at further risk those most vulnerable be adjusted to enable people to be treated in hospital for other conditions, given the concerns of Cancer Research UK and the British Heart Foundation, amongst others, and whether we could take into account that 2 weeks ago, when I hope we reached the peak of deaths from the virus, there were 2,300 estimated additional deaths not related to COVID-19, which must be a great worry to all of us.
The Noble Lord is...
Minister, sorry.
I completely agree with the Noble Lord in his concerns, both about those who are clinically vulnerable and also the potential for a rise in non-COVID excess deaths. The second is a matter of extreme concern, and the example of those with cancer who are going to hospital to have operations is a very, very good and clear example. These matters are very much at the highest of the government's mind.
Baroness Thornton, supplementary question.
Thank the Noble Lord the Minister. According to media reports, those who are particularly vulnerable to the virus could be advised to remain shielded for up to 18 months or until a vaccine has been developed. So could the Noble Lord the Minister confirm whether these reports are true? And secondly, the government had recruited 700,000 NHS volunteers to support those who are vulnerable or shielded. Most of them seem to have been processed, and many have been given nothing to do as yet, when there clearly is need. So could the Noble Lord the Minister tell me how quickly that issue will be resolved?
The Noble Baroness is entirely right. The prospect of long-term shielding for those most vulnerable is of deep, deep concern. That is why we are pressing so hard on the disease through the lockdown to try and get R as low as possible. And we will be putting in track and tracing measures to ensure that R can be held down and those that are in lockdown can be freed from their confinement. In terms of volunteers, the response has been absolutely incredible. It does take time to turn around all of the offers of help that we have, but we are moving extremely quickly to do that.
Lord Truscott, a supplementary question. Lord Truscott.
Yeah. Thank you, Lord Speaker. My Lords, is there not a danger that extending the lockdown only for certain groups may unintentionally discriminate against elderly and vulnerable people, Might a better way forward be mass testing, tracking, testing, and tracing, as the Minister mentioned, plus the rapid development of a vaccine? If the government is going to continue to isolate vulnerable people, would the Minister agree that this should be subject to review by an individual's GP?
The Noble Lord makes a reasonable point, but may I just confirm that it is the virus that makes this discrimination. It isn't the government, and it is certain demographics who are even more vulnerable than others. And it is an unfortunate fact that medically vulnerable are singled out by the virus, and we have to put in measures to protect and safeguard their lives.
Lord Lamont of Lerwick.
My Lords, following up on Lord Truscott's and Baroness Thornton's question, when we do get to the stage eventually of lifting restrictions, may I urge the government not to discriminate against the elderly on grounds of vulnerability, and not to treat the elderly as a single category. Many of the elderly continue to work. There are over 500,000 over 70s who continue to work. This group feel acutely the separation from loved ones. They are conscious of their own vulnerability and are perfectly sensible and don't need the threat of law to protect them. Will the Minister remind his colleagues when decisions come to be made about lifting restrictions that this is not a decision just for scientists, it is a political question as well, and a policy that may be acceptable in China may not be acceptable here?
My noble friend is entirely right that the political context in Britain is based on rule by consent, and we are not an authoritarian state. But I can't hide from my noble friend the point that I made to Lord Truscott, which is that it is the virus that is a discriminator, not the government, and that the clinical assessment of risk for many older people, particularly those with medical conditions, is very, very high. And the government will be guided by clinical advice on its advice and its recommendations to all groups, although the effect of safeguarding and lockdown on the elderly is fully understood, and we will put in as many mitigation measures as we can to prevent any long-term harm.
Baroness Brinton, supplementary question.
My Lords, on the 16th of March, Lord Bethell told the House that anyone with an underlying health condition would be contacted by local GPs in order to clarify exactly what kind of risks the individual face. A very large number of people still haven't had their letter or text from the government saying they should be shielding, let alone conversations with GPs. And I know I'm in the shielding group, and I know that my consultant has told me that I should prepare to be shielding for 18 months. Can I ask the Minister if he can confirm that everyone who should be shielding has now been notified by both the government and their GP that this is the case?
The noble Baroness is entirely right. The letters should have been sent to all those who should have been shielded. I am aware, as she rightly points out, that this was a process that happened extremely quickly, and there was a very fast turnaround. I have accounts of people who were sent a letter who shouldn't have had a letter, and I have accounts of people who should have had a letter who didn't get a letter. We are working hard to fill the gap, but 1.3 million letters were sent out, and on the whole, I believe that this exercise has delivered clear recommendations to those involved.
Lord Lucas, supplementary question.
To follow on from my noble friend Lord Lamont's question, can we please ensure that vulnerable people have agency, that those who want to act as the unvulnerable are allowed to, that grandparents who wish to see their children are allowed to, and at the same time those who are young and vulnerable are protected in their decision to continue to isolate and not discriminated against because of it?
Minister?
My noble friend Lord Lucas makes a completely reasonable plea, and on a personal level, I completely understand where he's coming from. I have elderly relations who I'd like to see and hold and touch and socialise with. But as I have said previously, I cannot hide from the chamber that this virus is an extremely predatory killer that has in its sights particular demographic groups, and they include the elderly and particularly those with conditions. And it would be wrong of me to mislead the House to pretend that there was an easy way out of this epidemic for those who the disease seeks to attack.
Thank you. Lord Carlisle of Beru, supplementary question.
My Lords, given that some very healthy older people mistakenly have received 12-week lockdown letters, including inaccurate and anxiety-causing assertions that they have underlying medical conditions, will the government permit an arrangement whereby the relevant GP practice can confirm or refute the issue of the letter and certify to that effect?
Minister?
My noble learned friend makes a very reasonable request. I have sought to try and find some clarification from the department on this point, because his suggestion does seem eminently reasonable. And as soon as I have a reply, I will write to him and share the contents with the library.
My Lords, I regret that the time allowed for this question has elapsed, and I'm very sorry and apologise for the few people at the end of the list who haven't managed to get in, and we will seek to deal with that in other allocations of questions.
David Blunkett.
My Lords, we now come to the third oral question. Baroness Sheehan.
I beg leave to ask the question standing in my name on the order paper.
Minister? Oh, come on. Minister?
As of the 21st of April, 129,044 people have tested positive for COVID-19. This represents less than 0.02% of the population. When the evidence demonstrates that it is safe to do so, we will adjust the lockdown arrangements. We have set out the 5 conditions which need to be met before lockdown measures are adjusted. These include needing reliable data from SAGE showing that the rate of infections is decreasing to manageable levels across the board.
Baroness Sheehan, supplementary question.
My Lords, it's very clear that testing is the way out of this. Firstly, there is the immediate urgency to test frontline health and care workers exposed to high viral loads through lack of proper PPE. And this we could do now if the government were to give the go-ahead to local private research labs with the necessary level 2 clearance, who will not take resources from Public Health England's needs. And secondly, of course, there is the urgent need to mass test. So could I ask the Minister, why is the government foregoing the first in favour of a gold standard testing regime that it can control from the centre to deliver the second? Can it not do both?
Go to sleep. Wake up.
Baroness Sheehan.
Sorry.
The Minister.
I beg your pardon. I did forget to unmute. My Lord, testing is the.
Baroness Sheehan, I got the message.
I think the Minister can reply. We know that.
Lovely, thank you.
I'd like to thank the noble Baroness Sheehan for a very clear question. Can I reassure her on 3 points? Firstly, frontline staff in the NHS and in care homes are eligible for a test on request, and we will be opening lines so that they can phone and book their own testing shortly. Secondly, I would like to commend and thank those private research labs who already contribute enormously to our testing regime. And thirdly, mass testing is one of the options that we are looking at, and the Cabinet Office are devising their plans for the medium term, and will be publishing them shortly.
I don't know quite who's intervening outside, but I hope it can be stopped. Lord Dobbs, supplementary question.
Thank you, Lord Speaker. First, may I very sincerely thank my noble friend for his tireless work during this crisis. Did he by any chance see the BBC report yesterday under the headline, Deaths at a 20-year high? Digging into that needlessly sensationalist headline, it intriguingly reported that the apparent increase was 1/3 linked to the virus, but 2/3 linked to non-virus virus cases. What I'd like to ask my noble friend is this. We all understand that there is an inevitable impact on others while we direct our focus towards coronavirus, but has the government undertaken any study into the estimated increase in deaths for non-virus patients during economic lockdown? And if so, will he publish its conclusions?
Minister?
The Noble Lord Dobbs is entirely right to put his finger on this important matter. The CMO was clear from the very beginning that the threat to Britain's mortality rates came as much from COVID as from non-COVID deaths. This is a situation we review regularly and entirely, and we would be glad to update the House at a future date, and we're very conscious of the threat of which he speaks.
Lord Krebs, supplementary question. Lord Krebs? No. Lord Haynes, supplementary question.
My Lords, I declare that my wife is a board member of Care Providers. Could I ask the Minister, how on earth is the government going to lift restrictions without universal testing?
Is now exiting.
Especially in care homes where there's virtually no such capacity at all and where there isn't even enough personal protection equipment. The charity Leonard Cheshire has been forced to spend an additional £250,000 a month sourcing PPE like gloves and masks. In a South Wales care provider, £100,000 extra monthly. The government needs urgently to give billions more to care homes instead of leaving them so badly in the lurch during this crisis.
Minister.
Can I reassure the Noble Lord that testing for care homes has been opened up to all care homes, and I'd like to pay tribute to the CQC, who played a pivotal role in providing access to Britain's 12,000 care homes on that. En masse testing, it is an option that we are looking at, but can I just remind the Noble Lord that in Korea, where they have an extremely energetic track and trace facility, they do on average 20,000 tests across the country, which is less than what we do in Britain on an average day.
Lord Oates, supplementary question.
My Lords, we all understand the immense pressure that the Minister's department is under. But wouldn't he agree with me that it is unacceptable that testing capacity is still only at 38,000 tests a day, and that much of that very limited capacity is not being used, not least because the testing centres are often in out-of-the-way places which NHS and care staff cannot easily reach? Can the Minister tell the House whether an assessment of public transport accessibility was made before these centres were chosen? And will his department now urgently work with drive-through restaurant chains and other accessible venues to ensure that testing centres are put in places that NHS and care staff can easily attend?
Minister?
The Noble Lord raises a completely valid point on the accessibility of drive-in centres. They suit some people, but not all people, as he rightly points out. That's why we have brought in at-home testing arrangements delivered mainly by Amazon. They started on Monday, and we are very ambitious for both the scale and scope, particularly for the demographics of which he speaks.
Baroness Lawrence of Clarendon, supplementary question. Baroness Lawrence. Lord Moynihan, supplementary question. Lord Moynihan.
Given that over 90% of the population are unlikely to have suffered from COVID-19 when restrictions begin to be lifted, will the government initiate and support a nationwide fitness and recreation campaign, given that physical exercise can help ensure immune systems become stronger and less susceptible to infections and their most severe consequences, and to a greater ability to recover from infections?
Minister.
The Noble Lord is entirely right. Fitness and the COVID epidemic are closely connected. The Secretary of State for Health has made it clear that the daily walk should be a part of everyone's lockdown arrangements, and we are ambitious for making fitness and diet a part of the agenda as we leave the COVID lockdown.
Baroness Finlay of Llandaff, supplementary question.
Thank you, Minister. May I thank you too for being open to communicating with us during the period before Parliament resumed. Could I ask what assessment the government has made of combining repeat virus detection with those risk factors that the Intensive Care National Audit and Research Centre contemporaneous data has shown are associated with particularly poor outcomes? And I refer particularly to high body mass index indicating obesity, and how that will inform the exit strategy from lockdown.
Minister.
The Noble Baroness speaks of anecdotes which we are very aware of. We are very conscious of the stories, particularly from America, of a correlation, a seeming correlation, if not a causation, between obesity and COVID mortality. Clinical trials and clinical data on this is short. The CMO has not made a declaration on it, but I would like to share her instincts that there is a strong connection, and that, as the Noble Lord Moynihan suggested, fitness and diet are going to be important parts of our post-lockdown experience.
Lord Wood of Anfield.
Thank you, Lord Speaker, and thank you, Minister. We can understand the epidemiological value of antibody testing, serology testing, but I'm interested in the public policy uses that may come from antibody testing. Is it the government's intention to use evidence of antibodies in individuals to say that some people rather than others can return to normal lives sooner, in particular people of working age and younger people rather than older people?
Minister?
Serology tests provide important data on the behaviours of the virus. We still don't fully understand what kind of immunity and what kind of antibody response will be long-lasting in the body. There are mysteries to this virus that are yet to be unsolved, and serology tests are vital to that. It can play a part in the back to work strategy, but I would remind him that it's a tiny proportion of the population, probably around 5%, who have antibodies, and we can't put the economy back on its feet with just 5% of the population.
My Lords, I'm afraid the time allowed for this question has elapsed, and there are two who have not been called, and I'm sure that will now be taken into account in future lists. My Lords, we now come to
Baroness Lawrence.
We now come to the fourth.
Is now exiting.
Lord Forsyth of Drumlene.
My Lords, I beg leave to ask the question in my name, standing on the order paper.
Minister?
Good morning, my Lords. We are constantly reviewing the coronavirus business interruption loan scheme to make sure that businesses can access loans quickly and easily. This includes looking at what other countries are doing to inform our own scheme designs. The changes we made to eligibility tests mean that even more UK businesses are able to apply for the CBILS loans, and we are working with the British Business Bank and lenders to ensure that we are doing what we can to speed up lending. As of the 15th of April, 6,020 loans worth a total of 1.1 billion had been given out to SMEs, and we expect to see this increase substantially when weekly figures are published tomorrow.
Lord Forsyth of Drumlene, supplementary question.
My Lords, may I draw attention to my interests as shown on the register. As there are more than 5 million SMEs in this country, and less than 1% have formal applications being considered or approved under the Coronavirus Business Interruption Loan Scheme, amounting to just over 2 billion, how many businesses is the government expecting to fail as a result of the lockdown? And given the Chancellor's promise to, I quote, do whatever it takes to see the UK through this crisis, why is he rejecting the advice from the Governor of the Bank of England, the bank's chief economist, 3 former chancellors, a former bank governor, and experienced bankers to re-engineer the CBILS scheme to provide 100% guarantee in order to ensure the speedy and efficient transfer of cash to desperate businesses?
I thank my noble friend for his response, and of course the issue of 100% guarantees is an issue that has been raised by a number of other contributors. It is something that we are keeping under review. However, we think the structure of the scheme at the moment is appropriate for its function. We don't believe it's right to put all of the cost of these loans directly onto taxpayers, and the bank should have some involvement in those loans. But as I say, we will keep the scheme under review, and I thank my noble friend for his question.
Lord Stevenson of Balmacara, supplementary question.
My Lords, the government's to be congratulated on the scale and indeed the welcome adaptations to be made to the CBIL scheme. But other countries seem to be dispersing more money more quickly to their struggling SMEs. In addition to the point made already about the increase needed in guaranteeing 100% of loans, would the government also think, in the interest of transparency, of insisting that the British Business Bank provide details of what loans have actually been delivered by the 47 accredited lenders?
Well, it's important to remember, my lords, that not all SMEs will actually want debt finance. There is a wide range of different support schemes available to business, including, for instance, the job retention scheme and various local authority grants. And we will be looking to publish, in the interest of transparency, the full range of offers that have been made to business in due course.
Lord Fox, supplementary question.
My lords, I join Lord Stevenson in congratulating BEIS, Treasury and HMRC and the work that they've done. But looking at the point in a different way, of those 47 attributed lenders, only the banks have the liquidity to lend at scale. And my lords, those banks are generally sticking to their current customers. So today, there are only 6 banks offering CBIL loans to new customers. And this is a really important issue. Furthermore, many are not lending below £25,000, and about 90% of applications are pitched at that level and below. So I was pleased the Minister said that this is a work in progress. And can he confirm that further modifications are now under consideration? And can the Minister undertake to ensure that the lack of access for new customers and the exclusion of lower value applicants is something that is addressed really quickly?
Minister?
I think the noble lord makes a very good point. And as I said, we have already introduced a number of technical changes to the scheme. Obviously, it was introduced very rapidly, so we are keeping all aspects of it under review. The one that he has mentioned is important. We are looking at bringing in new lenders as soon as possible, including, for example, Funding Circle, who specialise in smaller loans to companies such as those he talks about. But in answer to his question, yes, we're keeping it under review. We're seeking to get new lenders accredited as quickly as possible, and we keep all other aspects of the scheme under review as well.
Baroness Morgan of Coates. Baroness Morgan.
Okay. My lords, no one can doubt the government's commitment to bridging and helping SMEs to bridge these particular unprecedented circumstances. But following on from Lord Fox's question, what is the government doing to work closely with the British Business Bank to encourage them to dramatically widen the circle of lenders, in particular to embrace the UK's fintech sector, which can offer so much in these circumstances?
I thank my noble friend for her question. She makes a very good point. As I said in response to an earlier question, we are looking to expand the pool of lenders as quickly as possible, looking at Funding Circle. We are working closely with the British Business Bank to make sure that all aspects of the SME market are serviced. The BBB has put in place substantial additional resource to assist with processing applications from new lenders as quickly as possible. On the 11th of April, 4 new lenders were accredited, and we are looking to get the circle expanded as quickly as possible.
Baroness Bennett of Manor Castle, supplementary question.
Thank you, Lord Speaker. As the Noble Lord the Minister said, many businesses don't want to or are unable to rely on debt. And some of those are actually small businesses, like a owner of an independent cafe I've been talking to in Sheffield, who had all risks business insurance. who thought that they were covered for business disruption, yet have found that the insurance companies are refusing to pay. And this seems to be a widespread, even almost universal problem. And there seems to be a particular issue around the definition of physical damage and whether that's COVID-19 is included in that. A couple of US states are actually taking action to ensure that businesses are paid out. What action is the government planning to make sure that people with this all risks insurance in particular get the cover they reasonably thought they had?
Minister?
We are aware of the issue that the noble lady raises. Typical insurance policies offer cover against business interruption due to specific or notifiable diseases that are in fact listed in that policy. An available optional extension was available in many policies to cover pandemics, and unfortunately the majority of businesses did not choose to take up that option. We do not believe that it's right or feasible to require insurers to pay out retrospectively against a risk that was not covered in their original policy. But obviously there are a number of other support packages available to those businesses to see them through this difficult time.
Baroness Bennett, no, Baroness Blackwood of North Oxford, supplementary question.
Thank you, Lord Speaker. I very much welcome the match funding which has been available to our most innovative startups through the Future Fund. But could the Minister clarify how the scheme is going to operate? For example, will companies have a reasonable veto over to whom these loans could be sold on, because investors and executives will have an eye to their cap table? And will private investor capital lent alongside the government qualify for EIS relief?
I thank my noble friend for the question. She makes two very good points. On her first point about vetoes, we are aware of this issue and we are considering it closely as we work up further details of the scheme. And regarding her second point about private investor capital, I can tell her that private capital lent alongside the government capital will not qualify for EIS relief.
Thank you. Viscount Trenchard, supplementary question.
My Lords, whilst declaring my interest in the register, I regret that the government's intention to rescue sound businesses whose income has suddenly and completely dried up through the provision of CBILS loans has been less effective than intended as a result of the 20% personal guarantee requirement of some lenders, as pointed out by my noble friend Lord Forsyth. Would the Minister not agree that a reduction of the personal guarantee requirement to 10% might make a considerable difference to the conversion rate of loan applications to Lifelines Extended?
Minister.
I can tell my noble friend that we have made some changes to the scheme so that no personal guarantees are permitted for loans below £250,000. For loans above that level, lenders are permitted at their discretion to require personal guarantees for up to 20% of the remaining loan value. They are never permitted to use directors' primary personal residence as security, and lenders may only, of course, turn to personal guarantees post-recovery of business assets. We believe there is a balanced approach that protects CBILS borrowers, but like many other aspects of these schemes, this is something that we will keep under constant review.
Thank you. Thank you very much, my lords. That actually concludes the virtual proceedings on all the questions. We managed to get every question in that last group actually in. Thank you very much for that and keeping your questions short. The virtual proceedings will resume at 12:15 for the private notice question. So we're going out of it now, but 12:15 for the private notice.